This is Blue Cross's open enrollment. We're calling it an enrollment event for the people of the Shreveport-Bossier area, and we're offering the service of being able to answer everyone's Affordable Care Act questions, be able to help them with the things that they're not familiar with, the problems that they have incurred with respect to understanding the law and what's expected of them. We also have agents here, certified agents, that are prepared to be able to talk with them about particular programs that they might be eligible for, and also help them, which is a very important thing, with if they're eligible for a subsidy, which would be able to help pay for those premiums.
What are some of the common questions you're getting from the public today?
Well, the questions that they're getting is, we really don't know that much about the law. We understand we're supposed to do something. We understand there's a deadline of March 31st, and we're here to let you guide us through what our responsibilities are and what Blue Cross can actually do to solve these issues for us.
Now, who is required to have health insurance by March 31st?
Most everybody in the United States is supposed to have insurance by March 31st. And if you miss March 31st, the next open enrollment period won't be until November for the 2015.
What kind of penalties are people subject to if they don't have health insurance by March 31st?
Well, they could be looking at anything from $95 or 1% of their annual income, with a maximum of 3 penalties per family.
What are some of the options that are available for people when it comes to purchasing health insurance?
Well, the options are, you're going to be able to, these gentlemen that we have here, the certified agents, are going to be able to take people through the healthcare website and be able to let them know what is available from a product standpoint, what fits their needs, what fits their budget, and at the same time be able to take some information from them, put it into a formula, and let them know pretty close exactly what kind of a subsidy they could expect from the government to help pay for these premiums.
Hello, what's your name? Tomorrow, do you have a picture? What? Awesome.
Healthcare is so important, and I think right now we have the problem with everyone associates healthcare with politics. And so my main concern and my main desire is for everyone to realize that healthcare, just focus on the health of healthcare, not the politics side of it.
You've had a chance to talk to some young adults over the age of 26 about the importance of health insurance. What did you relate to them?
Well, I told them for sure, you know, like I said, the importance of healthcare, take everything else aside and just focus on what's best for you and for your family. And so that's basically what I've told them, is just to focus on the importance of getting healthcare. Everyone needs healthcare for sure, whether you think you do or not. Everyone has this mentality that, oh, it'll never be me, but facts are that it can be you. So that's the importance that we really want to drill into everyone, is that you need the healthcare because you never know when you might be the one to need it.
What are some of the keys to a healthy lifestyle?
Keys to a healthy lifestyle are eating healthy, working out, exercising, just doing everything you possibly can to keep your body in shape. I love working with Blue Cross Blue Shield, the people I've grown to love and know, and I love walking in and remembering their faces and them remembering me. We've formed this relationship, and I'm also glad just to see people signing up for health care and realizing that it is important and that everyone does in fact need it.
What are the general ranges of subsidies according to a person's income?
You start, it's all tied to the federal poverty level, which is just over $14,000 on an annual basis, and all the way up to a family of 4 making up to $94,000, a little over $94,000 per year would be eligible for a subsidy.
In addition to satisfying the law, what are the other advantages of people signing up for health insurance for the first time?
Well, what's really good about this is many people have been faced with pre-existing conditions in the past. The law has changed pre-existing conditions where there are none anymore, so persons that have not been able to apply for coverage or maintain coverage or be able to get coverage are now in a position to do that.
What kind of response and reaction have you had from the public so far?
Excellent so far this morning. We were opening up at 9 o'clock and we had people waiting at 8:30. So it's been excellent. And what's so good about this is we are performing a great service for people that heretofore haven't been able to get this type of information. So they have a place to go to, they have qualified people to talk with, and we're meeting their needs, and that's the main thing.
As the March 31st deadline approaches and people want to get more information, what should they do?
Contact us. Even after today, please contact us. Let us be able to guide them through the maze of what's expected of them, what the requirements are, what they're eligible for, and what they can apply for.
What website should they go to?
They can go to bcbsla.com.